Good morning, everyone, and the esteemed judges. I'm Dr. Navneet Chabra from Mahatma Gandhi Institute of Medical Sciences, Sevakram. I'll be presenting a case of congenital corneal staphyloma, a misdiagnosis or a misdiagnosis. Congenital corneal staphyloma is protrusion of an opaque ectatic cornea and an enlarged globe in between the lids. The case history was given by the parents who brought a 6-day-old full-term neonate with the complaints of left eyeball and globe protrusion since birth. The baby was born from normal delivery after a spontaneous conception. There was no history of any birth trauma, intranatal or postnatal infection, and no history of NICU admission or any drug exposure. The baby had a birth weight of 2400 grams and was born to a parents who had a non-consanguineous marriage. The baby was the first live birth and the parents had a previous history of abortion. On general examination, the baby was active and had polydactyly on the right feet. No systemic abnormality was detected. On ocular examination, we found that the left eyeball had an enlarged globe with an ovoid mass protruding antero-inferiorly in between the lids. The mass was soft to firm, non-tender, with a reddish-black surface discoloration. There was no transillumination present and the rest of the intraocular details could not be identified. The right eye examination showed direct pupillary reflex present and absent consensual light reflex. The anterior segment examination and dilated fundus examination were within normal limits. On performing the magnetic resonance imaging of brain and orbit without contrast, we found that on axial scan, the anterior-posterior length was 23 millimeters with an enlarged anterior segment and focal corneal thinning. There was outpouching of the globe anterior to the rectus muscle, as you can see in the inferior scan, and there was no intraocular calcification seen. There was anterior-inferiorly displaced lens with an hyperintense area on the posterior corneal surface, which was suggestive of the presence of uveal tissue in the baby. The other extraocular structures and the right eye examination was normal. There was no MRI orbit, no abnormality on the MRI brain. On performing the ultrasound B scan, we found that the baby had an increased axial length in the left eye of 21 millimeter with an irregular anterior corneal surface, no cataract or retinal and choroidal detachment. Right eye ultrasound B scan showed no abnormality. To detect the chromosomal analysis, we found that the baby had a 46XX karyotype, so the chromosomal analysis was normal, and molecular genetic reports have been done and are awaited for results. The human cornea develops on the 33rd day of gestation. The mesenchymal cells, which arise from the neural crest cells, develop the anterior part of the corneal stroma, the Bowman's membrane, the Desmond membrane, and the corneal endothelium. Congenital corneal staphyloma is a severe form of mesenchymal dysgenesis and is considered to be a variant of Peters anomaly, which is caused due to abnormal neural crest cell migration. The PITX3 gene, which is mapped on the chromosome 13, is associated with congenital cataract, anterior segment dysgenesis like this condition, Peters anomaly, and microphthalmia. A single case has been reported from China, which shows that the corneal staphyloma is seen in patients with PITX3 gene variant. On chromosomal analysis, as I have already previously mentioned, we had a 46XX chromosome karyotype, and we are waiting for the cytogenetic reports for PITX3 gene. These babies have a poor visual prognosis and are mostly treated either by enucleation and, if detected early, by penetrating keratoplasty. We are following up our patient and we have confirmed our clinical diagnosis by magnetic resonance imaging, which showed an enlarged globe, ectatic cornea, antero-inferiorly displaced crystalline lens, thus confirming the clinical findings with the MRI findings, which was similarly seen in the study conducted by Al-Judabi et al. These are the serial photos of baby which was monitored by us. Finally, I would like to conclude that congenital corneal staphyloma is a rare clinical entity, and diagnosing and clinical examination of this is a clinical dilemma, especially in neonates. So we need to report these kind of cases. To the best of our knowledge, this is the rare clinical presentation and no such case has been reported from India. So we are presenting this case to report its rarity. And finally, I would like to say, if you find these patients next time, let's not miss the diagnosis and misdiagnose this condition. Thank you.